It's Fran, your friendly nurse here. What three words could I say to you right now that would change your life and how you think about every single choice you make? What could make you change your priorities in just a few short seconds? Think about that for just a minute. Here's another question for you. Have you ever lost anyone you love to a genetic disease? You, your family, your friend, or your patient could be next. So, what is a genetic disease? It's an illness, disorder, or condition caused by anything that would be abnormal in your genome or in your microscopic DNA. That means the problem is in your genes or your genetic code. It may have been inherited and may or may not have been expressed in your siblings, parents, or grandparents. So, what are the top five leading causes of death? Um, Cancer remains a leading cause of death, second only to heart disease. And to those two fatal giants, add stroke, diabetes, and Alzheimer's. And there you have the top five leading causes of death in Americans. The information we're going to talk about today is more centered on cancer, but it also applies to all of the other top leading causes of death because they share many of the same risk factors and all respond well to what we're going to talk about. So let's start with a little bit of background. So, what can cause cancer? I beg you to listen. I made a mnemonic to help you remember these important causes of cancer with the three letters in the word beg, B-E-G. B is for behavior, E is for environment, and G is for genes. So let's get back to that life-changing question. What are the three scariest words your healthcare provider could say to you right now? You have cancer. You probably wouldn't hear anything else after hearing those three words. Unfortunately, the statement is probably true, whether it was in your past, present, or future. You've probably had it since you were in high school between the ages of 15 to 17 years old. We all have cancer cells in us throughout our lives. But how can this be true? Why aren't we sick all the time then? Well, we also have an amazing defense mechanism called our immune system, and it's constantly monitoring for cancer and trying to destroy it as soon as it's found. So, why does cancer cause problems? There are things that affect the functioning of our immune system, like medication, disease, and stress. Many diseases can leave us immunocompromised. And you've probably heard about these in light of the current global pandemic with COVID-19, because they also put you at higher risk of getting sick. These include conditions like diabetes, heart disease, respiratory disease, being older in age, and using medications like immunosuppressants and anti-inflammatories. So, what kinds of cancer are there? Where can you get it? Unfortunately, there's over 100 types. You can have cancer anywhere from head to toe, in your brain, mouth, neck, lungs, pancreas, or in your colon, ovaries, uterus, prostate, rectum, or in your skin, cartilage, bones, lymph nodes, and even blood. Averages of lifetime incidence are very high, with 1 in 2 for men and 1 in 3 for women. Just think about how many people that affect in your family, friends, church, where you work, the patients that you have. So, genetics, what does it mean? It's the study of heredity or genes or inherited characteristics. And why does it matter? Your genetic code tells your cells what to express or become, cell by cell, before you're even born. You might be born with a predisposition for things like diabetes or anxiety or cancer. There are genetic tests that can be interpreted and tell you whether you're likely to have one of these disorders. Genetic testing has become more widely available and can be done relatively inexpensively at home with test kits. They may ask for a DNA sample where you just mail in a little bit of saliva to the lab for analysis. So, what if I mail my sample in and it says I'm at high risk for diabetes? Does that mean I am destined to become a diabetic, dependent on insulin, waiting for an amputation? Yeah, maybe and maybe not. But if I can't change my genes, then my destiny's written in stone, right? Not necessarily. Genes are part of the recipe, but many other factors are also involved. That brings us to epigenetics. What does that mean? It's the other part of the recipe. It has to do with how that genetic information we just talked about is modified or influenced by our environment or lifestyle. You can think of it as a light switch that turns a gene on or off to make it do something or suppress something. The good news is that most of these are at least somewhat modifiable risk factors and include our behaviors, where we live, the choices we make about smoking, drinking, illicit drug use, diet, and exercise. This is where we really can have an impact. Epigenetic clocks can also be used to measure our biological age using DNA methylation profiles or epigenetic markers that can help predict common chronic diseases. I looked at a lot of research, but Dr. David Servin Schreiber has an anti-cancer plan, which has a few recommendations that summarize all of it nicely and make it easier to remember. He includes managing stress, getting exercise, avoiding toxins, and eating healthy. I came up with another mnemonic to remember what to do to prevent cancer using the word STEM. S is for stress management, T is for toxin avoidance, E is for eating healthy, and M is for move. So, when does all of this come into play? As early as possible. Why? Because any disturbance during the development of germ cells in embryonic development can happen before a woman even knows she's pregnant and has the potential to alter epigenetic programming. Teratogens are toxic to an embryo, and all of the major organs are formed by the end of the 8th week of pregnancy. Living a healthy life is especially important during early childbearing years. Research shows that adverse nutritional, psychological, and social conditions, along with pollutants and substance abuse in early life, can cause epigenetic reprogramming and increase an infant's chance of having problems like behavioral issues, depression, anxiety, and being at a higher risk of addiction. Some research even shows that you can be affected by 2 generations back with things that your grandparents may have been exposed to. So, what we do matters to you, your kids, and even your grandchildren. Many people are diagnosed with cancer and left to wonder if they could have done anything to prevent it. It's difficult to know, but the research shows that making changes today, no matter how small, can decrease the incidence and recurrence of cancer. If we start early enough, we may even prevent it in the first place. That's why I'm talking to you about this today. Many cancer patients are treated with surgery, chemotherapy, radiation, or a combination, but are not necessarily told to make changes in their lifestyle. You can choose not to live around a power plant, use carcinogenic or cancer causing chemicals, eat red meat frequently, consume high fat, salt, or sugar foods. You can choose not to smoke, drink heavily for a long period of time, take illegal drugs, take medications with damaging side effects, live a sedentary lifestyle. You can choose not to repress stress, get little sleep, keep damaging emotions to yourself, and live in a constant state of fight or flight, activating your sympathetic nervous system chronically. Let's get back to how to prevent this from the stem. Stress is good in some situations for a short period of time. Long term, it can cause lots of problems and decrease your immunity. This is why stress management is recommended to boost immunity with methods like yoga, meditation, mindfulness, and taking a holistic approach to health. Lack of healthcare coverage and low socioeconomic status also contributes to a higher risk of cancer and other chronic diseases, and less opportunities for screening. So now we know that your genetic code and zip code are important to your health. Toxin avoidance is next, and we can make decisions to avoid things we know are toxic in our behaviors, like smoking, healthy food, living a sedentary lifestyle, drinking excessively, and using illegal drugs. Eating healthy and moving are next. Obesity is a problem in this country and rising at an alarming rate as stress, family, work, and financial issues leave us with cheap and convenient options offered by fast food. The food industry has been using many chemicals on labels that are addictive and misleading for years, but there are also many superfoods that naturally help boost your immune system and fight cancer and other diseases. They include broccoli, cabbage, cauliflower, onion, garlic, strawberries, blueberries, and raspberries. Ginger and turmeric are also anti-inflammatory. Eating a more plant-based diet is really helpful. Many of the chemotherapy treatments, like tamoxifen, are plant-based, but they're much cheaper and with no side effects if you eat them in your food instead of take them in your chemotherapy. Exercise has also been used to have positive health findings in each of the 5 leading causes of death, including heart disease, cancer, stroke, diabetes, and Alzheimer's disease, along with countless other conditions. Now that we've made changes to prevent chronic disease, we have to monitor for it. Screening is also recommended by the U.S. Preventive Services Task Force for breast cancer, cervical cancer, and colorectal cancer, because if we can catch it earlier, we have better rates of cure. In research, patients also cited a recommendation from a healthcare provider as the most important reason for having this type of testing done. So share the good news with your patients and family. They can take control. In conclusion, I am begging you to make healthy choices and teach others to do the same. What is the cause of most chronic disease that can kill us? It's easy to remember using the mnemonic BEG: behavior, environment, and genes. What is the simplest method to prevent fatal diseases? Dr. Schreiber's anti-cancer plan summarized it best in easy terms with modification in just 4 areas, which can easily be remembered using the mnemonic STEM. When there's a problem, we want to get to the root or stem of the problem. STEM: stress, toxins, eat, and move. Stress needs to be managed and dealt with. Toxic environments and chemicals should be avoided. Eat a healthy plant-based diet and move your body in whatever activity you prefer to increase your exercise. Remember the causes of cancer with BEG, and then get to the stem of the problem and prevent or treat the disease by changing the way you live. Thank you for your time.